day to all examiners. We are from Group 4 MDJ1632 Social Sciences. Our topic is to discuss the social institution of economy and the association to healthcare. From our viewpoint, does economy influence healthcare in Malaysia? And provide the examples. It is presented by Fatina Ilya, Fatina, Firdaus, Helen, Hihiachin, and Ilya Izzati. My name is Helen Anna Sembon and my matric number is 74981. I will be presenting the introduction. First of all, the economy is the social institution that organizes the production, distribution, and consumption of a society's goods and services. It consists of three sectors: the primary sectors, the secondary sectors, and the tertiary sectors. The two major economic systems in modern societies are capitalism and socialism. In practice, most societies have economies that mix elements of both systems, but they link toward one end of the capitalism, socialism continue. That's all from my part, and I will transfer you to my teammate Fatina. Thank you.
Hello and greetings to the examiners. My name is Fatina binti Abdurazak, bearing matrix number 73458. I am going to elaborate on the first reason why we agree that economy does influence healthcare in Malaysia. The healthcare system in Malaysia is divided into two sectors, which are the government-led sector, which they are funded by the public. For example, in Kuching, we have Sarawak General Hospital and Klinik Kesihatan. Other than that is the private sector, which are self-funded, such as in Kuching, we have KPJ Kuching Specialist Hospital and Norma Sarawak Medical Center. The government-led sector, also called public healthcare sector, is heavily subsidized by general tax income, where patients will only need to pay nominal fees for the services. However, only Malaysian nationals are allowed to pay nominal fees in this public sector, where foreigners are also eligible for public healthcare as long as they pay additional fees. The general income tax is collected by the Malaysian government towards the working citizens of Malaysia in percentages through their income. The tax is collected in order to collect government tax revenues, which pays for the services and medications in the public healthcare. In a case of economic crisis, it will affect the public healthcare system through the subsidies of the fees. Many people lose jobs during economic falldown. Therefore, the government will not be able to collect general income tax from these people for the revenues. If the economic falldown persists, more and more people will lose jobs, and the general income tax, which is the major source of government tax revenues, will also decrease. Therefore, the subsidy for the public healthcare will also decrease following the loss of revenues. Malaysian national patients can no longer pay nominal fees for these services and medications, as they are lesser and lesser subsidy to pay for the rest of the fees. Thus, the healthcare is not widely available for everyone because of the expensive fees. That is all from me, and now I will pass it to the next presenter to elaborate on the next reason. Thank you.
Good morning to the examiners. My name is Hihiachin and my matrix number is 74996. Today I will present about the topic, which is does the economy influence the healthcare in Malaysia? Before I start, I hope that you enjoy watching my presentations. So now I will start my presentation. From my viewpoint, I agree that the economy influences the healthcare in Malaysia. Economic crisis will cause the reduction of the public sector supply. Public sector consists of an expanding ring of organizations with core government at the center, followed by the agencies and the public enterprise. Public healthcare can ensure everyone can get the care and treatment when injured or getting disease. Because of the economic crisis, government does not have enough money to buy the healthcare instruments, medications, vaccinations, and machines for other countries. Thereby, it causes the reductions of the public sector supply. Reductions of the public sector supply will directly influence the people with low income to get the care and treatment. This is because the cost of treatment, vaccinations, and medications in private hospitals is very expensive. For example, cancer treatments such as surgery, chemotherapy, and radiation therapy, which can remove the cancer cells that supplied by the private center, is more expensive than the supply by the public center. Another example is the vaccinations of hepatitis B and medications of cancer in private hospital is also very expensive. All of these examples can cause the statistic of the rate of death in Malaysia increase since the people did not have enough money to treat their illness in private hospital. Since the health is very important for everyone, thus, I hope the economic crisis does not happen in Malaysia so that the reductions of the public center supply in healthcare does not occur. All above are the elaborations and explanations are my own critical thinking. I think that's all from my presentations. Thank you.
Good day to the lecturers. My name is Ilya Izzati binti Muhammad Hazli with matrix number of 73495. Based on the title allocated to us, I do agree that economy can affect healthcare in Malaysia. The occurring of economic crisis will cause struggle of people financially. This will cause unemployment, decrease in income, or dropping in insurance coverage. This will obviously impact those with lowest household income to survive in an increasing cost of living. Therefore, those with low income household may be very careful and minimal in expending their money either for food or healthcare services. On the other hand, economic crisis can also lead towards increasement in mortality rate due to excessive stress, substance abuse, wide range of psychiatric disorder, malnutrition, and so forth, which cut during recession among the healthcare provider may also affect the quality of services given. Those who lack in professionalism may let their emotion involved in their jobs, hence causes the quality of the care decreases. In conclusion, I do believe that economy can cause fall of health service utilization in Malaysia.
Hi, my name is Firdaus bin Ignatius and my metric number is 73463. Regarding the question, does the economy will influence the healthcare service in Malaysia? For my opinion, the economy will not influence the healthcare service in Malaysia. This is because the healthcare provider in Malaysia will maintain their professionalism during works. The healthcare provider will provide the best service to satisfy the patient in the hospital, even though their wages been reduced and overworked. Therefore, the healthcare service utilization still work in Malaysia, even though the economy will drop someday.
Hello and good day to the examiners. My name is Fatin Noella Maisara binti Ahmad Razali, and I will be concluding for our presentation. Economy can be defined as a social institution that provides a production, a distribution, and a consumption of a good service of that country. Economy also have a pros and cons, but it can be important as it helps to improve the living standard of people. At the same time, it can make the country become a better place to stay. When the economy increases, it can create a higher income and tax and reduce the poverty. Based on the discussion, we can conclude that economy really have a pros and cons for the healthcare system in Malaysia. Health economy can be important as it can determine on how to improve the health outcome and the lifestyle pattern of that person. But when the economy starts to decrease, the country will have reduced its income, made some of the price will increase drastically. For example, the drug or medicine that we use and the fees that we have to pay when we visit the hospital or clinical. That's all from us. Thank you and have a good day.